Next topic, vitamin K. Vitamin K, like vitamin D, was misnamed. Vitamin K should have been named like vitamin F, as in A, B, C, D, E, F. But it got named vitamin K from the German word for coagulation or blood clotting. And this has been understood as the most important vitamin for the coagulation system. And that has been the focus of attention for the last 50 plus years. Only in recent years, people said, oh, vitamin K activates 17 different enzymes in our body, 17 different proteins, what's called post-translational modifications, activation, only 7 of which have anything to do with clotting. The other 10 have to do with bone health, vascular health, heart health, brain health, anti-inflammatory activity, male fertility, and anti-cancer activity. Now, these are good sources of vitamin K. Think green leafy vegetables. Vitamin K comes from 2 sources on our planet. The plant kingdom, and makes vitamin K1, or the microbial kingdom, which makes vitamin K2. We are completely dependent upon vitamin K coming from one of these 2 sources. Now, dietary vitamin K1 can be turned into vitamin K2, but it's a difficult process, and there's good reason to believe that might not work for all people. So we need to pay attention to vitamin K2. That requires attention to diet. You can get a little bit from aged cheeses and the like. The best source on the planet is a traditional Japanese breakfast dish called natto. Natto is a fermented soybean. It is a delight to eat. Oh, someone's smiling, someone's laughing. Yes. Okay, so in Japan, you put it on top of a rice bowl, and you would kind of scoop it in. It is sticky. Impossible not to end up with a kind of like spider web of goo on one's face. It is aromatic, and if you ever want a good laugh, go to YouTube and type in N-A-T-T-O and kids, and you'll see it's a delight. But most Americans aren't having much natto for breakfast. My question is, why not natto? Well, here are the forms of vitamin K. Vitamin K1, it looks like this. Vitamin K2 comes in 2 forms, you might find. MK4, which is 1, 2, 3, 4, or MK7, 1, 2, 3, 4, 5, 6, 7. Now I'm pointing these out not to be particularly geeky, but to point out that there's something really beautiful here. And part of the kind of beauty of the universe is found in these little structures right here. And we'll come back to those in a little bit. But they play a very important role in life, in nature, and in our health and well-being. What does vitamin K literally do? It literally gets recycled back and forth so that a reaction can take place where it's called a gamma carboxylation reaction. But essentially what we're talking about is after the DNA has done its work, this is that one comes in and then it activates key proteins in our body. The key proteins, bone health, vascular health, heart health, brain health, anti-inflammatory, male fertility, and anti-cancer. Now, one of the beauty of the universe moments is to recognize this is coenzyme Q10. Coenzyme Q10 and vitamin K look so similar. And the 10 in coenzyme Q10 is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You've got these 10 units and either 4 or 7 in the vitamin K. Coenzyme Q10, like vitamin K, is a very potent antioxidant as it protects us against lipid peroxidation of things like brain cells and other cells throughout our body that can be driven by a variety of things. Post-chemotherapy, it's good to have a lot of CoQ10 and a lot of vitamin K for kind of restorative issues. I can tell you, based on a publication recently in Science magazine, simply giving oral vitamin K restored mitochondrial dysfunction in an animal model of Parkinson's disease. And I can tell you in my clinic, I have seen people go from to with oral vitamin K. And my colleagues at the Mayo Clinic, they said, wow, that exercise program must really be working. Well, yes, and so it's kind of yes, and. I think this is really important to know about. Now, the key thing is, vitamin K is a critical role in bone health. There's a lot of reasons why it's been well established, a lot of reasons why every bone clinic in this country should be looking at vitamin K. Among them is the fact that 100% of Americans have now been exposed to glyphosate, Roundup. Roundup was approved because the FDA heard that the pathway that Roundup blocks, called the Shikimadi pathway, only is found in the microbial kingdom. So no critter in the animal kingdom could possibly be harmed because they don't have the pathway that it affects. And that's why you can see Monsanto officials saying, oh, I can drink a gallon of this and not worry. Well, no, it's not true. Because, in fact, we have a symbiotic commensal relationship with our gut bacteria. And among the things they do for us is produce vitamin K2. But they can't do it when we have glyphosate in the air, in the water, and the food we eat. So there are a lot of reasons why it makes sense to actually supplement with vitamin K2. Now, vitamin D and vitamin K are now being marketed together, and so it's very easy to find products, one capsule, kind of like two birds, one capsule type idea. Going back to, you say, well, does it have any role in cancer? Yes, so it's really kind of described in 1947 having very significant anti-cancer activity. Now, 1947, in the history of cancer care, there were other things that became more exciting that came along. New technologies, things, new chemotherapies, the whole excitement around derivatives of vitamin A having profound anti-cancer activity. The first breakthroughs in pediatric leukemia were a variation of anti-folate activities. And so, in fact, it kind of got sidetracked. But we can know that even recent studies and basic science studies have shown significant activity in a variety of areas. Don't need to know these words, just need to know that, oh yeah, these are anti-cancer activities. And you can say, oh yeah, we can get really geeky, but I just want to show you that all these things here are where vitamin K actually inhibits a variety of things that lead to cell proliferation and cell differentiation. If we don't have vitamin K present, then we're out of balance in these issues. Now, and vitamin K2, at least in experimental animals published recently in August, improves the effects of benzoyl acid we talked about in the beginning that has such great evidence base for improving outcomes.